more things changing for your business in terms of resources and opportunities. But we really want to be focused on what do you need to know going forward. So today's program and lineup is a great example of that. We're joined by Dr. Scott Campbell and the Erie County Health Department and attorneys from Corman Jackson Krantz law firm to talk about implications of vaccination. Obviously, a lot of efforts underway across the nation in that regard. What do you need to know for your business and workplace? What does it mean for yourself? And then I think it's an interesting idea, you know, as we want to know a lot about vaccination, we'll all be a little bit honest that we're interested in that topic so that we can kind of get back to normal. But I think what you'll hear from Jason to close the program is there's probably no back to normal. So a lot of consumer behaviors have changed throughout the pandemic. And what does that mean for your business in terms of communication, whether your client is a fellow business or a consumer? My guess is there's going to be no back to total normal, and Jason's going to talk about that and what that means for your company. So I want to be brief today to give a lot of time to Jason, Scott, and KJK. Our updates from Acadec, I did want to make a couple notes. You obviously have seen the news this week or last that Biden's America Rescue Plan has passed. We tend to focus on just updates from business resources. There are a few new programs that will roll out of that stimulus package, one targeting restaurants and bars. Just please note the guidelines for that has not opened yet, but it will be administered through the SBA. Likewise, some of you might have read about the Shuttered Venue Operators Program. It was actually open last year, but we're still waiting on guidelines from the SBA, or at least firm ones as to how you can apply. So be on the lookout for our email series. We'll make sure that you get that information as soon as it's available. But our recommendation for both state programs and federal programs that are making their way through the regulatory process is you kind of know the departments that will administer those programs. So if you have not registered your business previously, now's the time to make sure that you have that Ohio ID, that you have visited the SBA website, and that you've gotten into their portals. We don't want any tech issues preventing your access. And secondarily, most programs rolling out at both a state and federal level will likely have some sort of component of proved losses comparing 2019 and 2020. You've seen that with a lot of new programs. So if your paperwork is not in order, again, now's the time to be sort of prepping for those future opportunities. And last from my end, wanted to highlight the grant program that Sarah Ross spoke about on our last session. The deadline is March 31st for that. Sarah will chat in her email address, the real Sarah Ross, and you can contact her with any questions on that grant program. And with that, I'm going to hand it over to Abby, again, our usual host here with the Erie County Health Department. She had any quick updates from her team, and then we'll move on with the program. Abby?
All right, thank you. Are you able to see my screen here? Are we, oh. It says that it's screen sharing's disabled. That's okay. I can go through very quickly without that. But again, my name is Abby. I'm from the Erie County Health Department. And so I just have a very quick update today. So we are looking at, as of today, 4,580 total confirmed cases. That's an increase of 74 cases in the past week, so that we're looking really good. It's still more than, of course, where we want to be, but compared to where we were, November, December, January, we are seeing, a much lower caseload than what we had been seeing. Unfortunately, we did have an additional 9 deaths this week. So that's very unfortunate. The deaths do tend to obviously lag behind case reporting. So we have had a total of 197 deaths in Erie County. And I also then wanted to quickly just discuss the expanded vaccine eligibility. So as of today, anybody aged 40 and older is now eligible to receive the vaccine. So that's very exciting news. And then they did add a couple of extra health conditions that now, so anybody under 40 who has these additional conditions, so cancer, chronic kidney disease, COPD, heart disease, and obesity. So anybody under 40 who has those medical conditions are now also eligible to receive the vaccine. And then really exciting, as of March 29th, so about 10 days from now, all Ohioans age 16 and older will be eligible to receive the vaccine. So that's very, very exciting news. We are going to be working here with Firelands and partnering and getting some additional shots directly through the federal sourcing. And so that's really exciting. So you're going to see more availability as we begin to get more vaccination available. And so we'll continue to post those on our website, the appointments. So definitely keep going back to check coviderieohio.com for vaccine eligibility. And that is all I have.
Thank you, Abby. We appreciate the updates, and I'm sure we'll continue to see more from the organization. And actually, I bet Dr. Campbell's comments will overlap nicely about what's next on the horizon for the health department and the hospital system. Thank you both for your work on those things. Dr. Campbell, I'm going to hand it over to you now. If you would kick us off, our focus for at least the first half of this hour is the practical implications of vaccination. On the line, we have just a variety of business owners, all different sizes of industries and backgrounds, but what is it that you think they need to know as leaders in the Firelands region?
Okay, can you hear me okay, Abby?
I can.
All right, and thanks for the intro. I'm Dr. Campbell. I'm the Chief Medical Officer here at Firelands, and been the Emergency Department Director for the last 10 years, been the ER physician here at Firelands for 30 years. So been around a while in Erie County and working here at the Firelands. So I'm just going to start out with a quick overview. I'll get a little bit into the variants. I'm just going to teach you a little bit about the disease itself and then talk about vaccines. You know, you look back, we're about a year now into this when they called it a pandemic. We knew something was going on in Wuhan, China. Then we started seeing cases go up in Italy, and you know, we're at the hospital kind of thinking, is this thing coming here, or, you know, what are we doing? And so as it ramped up, we started to get our troops ready. As you may have remembered, you know, we put big tents up outside of the emergency room out back. Really didn't know what kind of army was coming over the hill and what we were to prepare for. And I know you've read throughout, you know, the whole year of what we've done here, but, you know, from the PPE issue, you know, stopping elective surgeries, trying to figure out how we were going to staff these areas where we were bringing more people in. Did we have enough ventilators? Do we have enough staff physicians? What if our people got sick? What if they were out, and how were we going to staff ourselves to take care of this virus? And then, you know, we were worried, you know, the people were worried they weren't going to live through this. I mean, there was real fear among the healthcare workers. You know, the heroes work here signs went up, and I think there was a lot of teamwork. And I was really proud of Firelands, the way they put everything together. But as with everybody else, this has become a long, drawn out process. Those heroes work here signs seems to have been a long time ago. So, you know, so what's the good news? The good news is what Abby just said from the health department is, you know, our numbers are down. Everybody knows that. We kind of feel good about ourselves right now. Vaccinations are going up. Our numbers are going down. Our hospitalizations and deaths, again, which lag behind cases, have basically gone down. You know, there's been about approximately 75 million first doses now in the United States for vaccine, which is fabulous. The more we can get vaccinated, the better. I'm a big proponent of the vaccine itself. About 2 million or so doses per day are being given. You know, between the vaccines, we're hoping, you know, sometime in May that everybody wants a vaccine can get one. And as Abby said, on March 29th, it's open to everybody, 16 and up for the Pfizer and 18 and up for the Moderna vaccine. You know, here at the hospital, we've had clinics in our front lobby every day. We vaccinate all our healthcare workers, working hand in hand with the health department on that link that Abby referred to. So you can go there to sign up for your vaccine. We're going to do a big sports force on Tuesday that we're going to do maybe 800 doses to 1,000 doses in one day. The vaccines are rolling in, literally. We're getting a lot of doses finally. And I think that's the way we're going to get through this and get out of this. You know, I'm always concerned when people say, you know, this isn't a big deal. Obviously, for us that have lived here at the hospital and been through this is a huge deal. And talk about it being just, you know, only the old people die from this disease. It's an old person's disease. You know, and if you look at the numbers, you know, about 85% of the deaths are people over the age of 65, which sounds like, okay, yeah, it's kind of that age group. But look at it a little closer, and about 15% of the deaths are underneath 65. Take that raw number times how many cases we've had or deaths we've had, and you're probably looking at about 75,000 people that have died this year under the age of 65. So certainly not just an old person disease. Are we getting to herd immunity? Everybody wants to know. Remember, herd immunity is not a line in the sand. We don't just get to herd immunity when everything gets to 75% and everybody's either been vaccinated or had the disease. Basically, that's a continuum of herd immunity. And right now we're looking at about 30%, you know, and this is tough to guess, but how many of our population's actually been infected? Some people have never gotten tested, have had the disease. So you're going to say about 30% of our population, 320 million people have been infected. About 20% have received the vaccine, which is going up daily. So we may be at about 50%. There's some overlap there of those that have had the disease and got the shot. So we're getting a little closer. And I think some of the numbers we're seeing that they're reflected in that kind of pushing our way toward herd immunity. So the variants, I just quickly touch on the variants. You know, we talk, everybody wants to hear about the variants or the scariants. I think I heard somebody said, you know, that they're getting everybody a little bit worried. You know, the what we need to pick up right now is the B117. The B117 is the one, the UK variant. That's probably about 20 to 40% of the United States virus population right now. If you look at a recent study they just did in Florida, they were up to about 40%. When it gets to about 50% in other countries, we started to see cases go up, hospitalizations go up, and deaths go up. And I think that's our biggest concern here right now is how much will this B117 variant affect our numbers? And did we get enough people vaccinated and our most vulnerable people vaccinated to keep them out of the hospital? If the cases go up and you don't end up in the hospital or have a bad outcome, then that's really what we want. So I wouldn't get all crazy about it, except I think we will get a little bit of a B117 UK variant surge, but we just have to keep marching forward with our vaccines and, of course, keep doing what we're doing. Everybody at the hospital, everybody kind of wants to relax right now and open everything up and say it's over. It's not over. There's a lot of countries right now like Germany and the UK and some European countries that are really seeing this UK variant go up. So the vaccines themselves, a quick question on that. You got the 2 mRNA vaccines and we got the Johnson & Johnson vaccine. So which one do I get? Well, it's all over the news, right? 95% efficacy for the mRNA vaccines. And what's that mean? If I get the mRNA vaccine and you do not, there's a 95% less chance of me getting COVID-19 than you. So that's good. The Johnson & Johnson then comes out and says, oh, 72%. And everybody kind of freaks out about that. But really what happens if you look at the data, the studies are completely different. The endpoints are different. You really can't compare those. The bottom line on those vaccines that all of them, 100% keep you from getting really ill or dying in the hospital. So it does not matter which one of these vaccines you get. At 49 days out, the Johnson & Johnson vaccine is just as good as the RNA vaccines. So I'm encouraging anybody, no matter which one comes up on your turn, to make sure you get that shot in your arm, because that's what really matters. So I know I'm on a quick timeline here. I'm going to just push through vaccines themselves. So I get a lot of questions. I fielded questions from the very beginning by the vaccine hesitants, right? We have the vaccine, we have the people that the reason they don't want a vaccine isn't based in logic. And I can't really reason with those people very well, to be honest with you. That somehow we're getting a microchip put into our arms to be tracked by the government. But the ones that are just hesitant for real reasons, they have some fears. They don't like shots. They're afraid of the vaccine. It's new. It went through too fast. Trump pushed it through too fast. So I think we're trying to really kind of get to those people and realize that hundreds of millions of these vaccines have been given, and that safety margin is really good. So one of the questions I get is pregnancy and breastfeeding. Can you get your vaccine if you've been pregnant or breastfeeding? And the answer from the American College of Gynecologists, the maternal fetal medicine, everybody says, yes, you should go ahead and get your vaccine. We do know that COVID-19 can cause premature death or premature births, can cause death in babies, and has caused maternal mortality and deaths in moms. And so you don't want the virus when you're experiencing pregnancy. So we want you to get that vaccine. Will it incorporate into my DNA? And the answer is no. Basically, all these vaccines do is send in a message. Your body makes the spike protein and you have an immune reaction to it. There's no virus involved. You cannot get COVID-19 from the vaccine. It does not go into your genetic DNA. So those two things are very clear. And a lot of people have concerns. Are there human embryos used in the vaccine? Answer is no. This is synthetic. This is made in the lab. There's no human embryos used in these vaccines. They're pretty pure vaccines. How long will my immunity last? My answer to that, I don't care right now. Let's get the vaccine. Let's get protected. Let's get protected from this surge that's coming and maybe the next variant that's coming. And if we need a booster in a year, so be it. It's the same as the flu. And I think we may end up needing a booster just to keep the longevity of this thing going. But right now, it doesn't really matter. I wouldn't get hung up on it. Allergies, pretty much, unless you've had some severe allergic reaction to something, and I mean severe, like you've been on a ventilator, you really had low blood pressure, anaphylaxis, then you can get this. If you just had a bad hive reaction to penicillin or something in the past, you can still get this vaccine. Just let the nurse know that's giving it to you, so she's aware that you've had kind of an allergic reaction to maybe some seafood or shot in the past. Side effects, yep, there's side effects. So those ones probably going to give you a little bit of an achy arm. Why? Because the immune reaction is going on in your cells, and the cells of your muscle, of your deltoid muscle of your arm, the immune reaction is going on. It's starting to do what it's supposed to do, and that causes inflammation, and that causes discomfort. That's okay. A lot of people will get a low-grade fever, a little bit of body aches, tired. Most of us at the hospital just didn't feel good for a day or two, just felt tired, like you wanted to go lay down. And you know what? That's a pretty small price to pay to be protected from this virus. Second dose, a little worse than the first. Don't take your ibuprofen or Motrin before you get your shot. Blunts the immune response a little bit because of the inflammatory reaction. So on that note, just take that afterwards if you need it. Is it effective in older adults? It is. Do I still need a mask and social distance? That's the big one, right? So what's the prize if I get a vaccine, if I still got to do everything I was doing before? And that's what a lot of younger people are saying, right? If I got to still wear a mask and social distance, and I'm not going to die from this thing anyway. And by the way, young people do die from this disease. But you know, one of the things I think we need to look at is what's next. So lastly, I just want to say, can I still get the vaccine if I had COVID? And the answer is definitely yes. We know there's a variable reaction to the actual infection, and you're better protected if you get the vaccine. So what is next for the businesses, and what is next for the hospital, and what is next for our world? You know, I think one of the things I tell the younger people, like my sons, is, you know, you may find you need a vaccine passport to go places. You may not be able to get on public transportation. You may not be able to get into a concert or a venue without showing that you're vaccinated. We don't know where we're going with this. We're already seeing that where cruise ships won't let you on unless you've been vaccinated. So I think that's strong encouragement for people. Besides the fact you're helping yourself, you're helping others around you, but it also may give you kind of a freedom pass, if you will, to be able to go out in the world. And I think that's going to come in all of our businesses. We have a business here at the hospital. How are we going to mask? How are we going to test? How are we going to allow meetings to occur? Are we going to really isolate who's been vaccinated and who hasn't? I think there's a lot of unanswered questions coming up. And I think that intro by Abby was, I don't know that we're going to get back to just normal, but we are going to get a lot better. And I think we're going to have to kind of incorporate all of these things as we move forward. So I appreciate you letting me speak to you, and I'll move on to the next segment. Thanks.
Well, thank you so much. We really appreciate that. I mean, we're certainly inundated with this kind of news. It feels really good to hear from a local doctor and again, about our local community. So, you know, we really appreciate your time. And to piggyback, you know, on your closing statements of what does next look like, we'd like to kind of explore that a little bit and see what might this look like in the workplace. So I'd like to introduce Kirsten and Rob from the law firm of KJK. who can tell us a little bit more about practical implications and what employers should be thinking about the vaccines. So let me share my PowerPoint. And Kirsten and Rob, if you can take it away.
Great. Thank you, Sarah. This is Rob Gilmore here. I am not Kirsten Mooney, nor am I Sarah Ross. I'm happy to talk to you today about what employers should be doing as they think about vaccines in the workplace. So, for the last year, obviously, we've all been dealing with many issues in the workplace as to COVID. Can we stay open? Are we essential workers? Can we work remote? Do we come back in a hybrid approach? All the money's coming from the federal government under the FFCRA in dealing with sick leave and FMLA. And always sort of out there on the horizon has been, hey, if we can just get to a point where we've got vaccine, there's sort of the holy grail and we can get back to work. Well, they're now, we've got a vaccine, but it's not as simple maybe as we thought many months ago when we just sort of looked out there and said, hey, there'll be a vaccine and everything will be good again. And so what we'll be talking about today is some of these issues relating to the vaccine. And, most specifically, do you mandate that your employees get vaccines? Do you just encourage them? Do you fire people if they don't get vaccinated? How do you address, the actual vaccination? Do you do it at the workplace? Do you tell people to go elsewhere, to CVS and get it handled that way? And as Dr. Campbell said, there are plenty of employees, plenty of people, including your employees, who are reluctant to get vaccinated for many of the reasons that Dr. Campbell mentioned and others. So. And polling has showed that, again, there's a large segment of the population that is not left to their own devices, would not necessarily get vaccinated. So what do you do? And we'll focus mostly on the EEOC, the Federal Equal Employment Opportunity Commission, came out with some guidance recently on vaccine mandates. And Kirsten's going to go through some of those and go through some of the issues under the Americans with Disabilities Act, and some of the key issues as they relate to vaccines. And so if you've got questions, certainly you can put them into the chat. We'll try to have a few minutes towards the end and hopefully all the slides. We have a lot of slides here. We'll go as quick as we can. If we don't get to something, at least hopefully you'll have them. So with that, I'm going to turn it over to Kirsten, and you might have to go back, Sarah, but I'll let Kirsten figure out where we're supposed to be in the slide. So here is the actual Kirsten Mooney.
Hi, everybody. Okay, Sarah, I think you can move forward. All right, wonderful. So I'm going to talk a little bit about, as Rob said, the EEOC's guidance. I'm going to try to pack a lot of legal stuff into a few short minutes, so bear with me. So the much anticipated guidance was released, like it says on the screen, December 16th, 2020. It added a lot, some additional Q&As to the website. And it addressed several laws, but I think the most prevalent ones and the ones we'll discuss today are Title VII of the Civil Rights Act, the Americans with Disabilities Act, and then also GINA, which is the Genetic Information Non-Discrimination Act. So great. You got it, Sarah. Thank you. The biggest takeaway from the EEOC's guidance certainly is them saying that the COVID-19 vaccine is not a medical examination. So as you'll see the definition on the slide for medical examination, a procedure or test usually given by a professional or in a medical setting that seeks information. When we think about these things, we usually think about, your traditional tests like vision tests, blood tests, screenings, x-rays, those sorts of things. But as you can see at the bottom, the EEOC has said that it is not a medical examination. And just kind of in sum, it's really because the COVID vaccine, unlike those other tests, does not seek any medical or health information. So with that, employers are good to mandate the vaccine. They can require employees to get the vaccine. Now, there are a few caveats, and we'll discuss those as well. Second, they have said that the pre-screening vaccination questions, so those questions that people ask you right before you get the vaccine, can be considered disability-related inquiries under the ADA. And because they may be disability-related inquiries, the questions are job-related, must be job-related and consistent with business necessity. So I have not received the vaccine. I'm hoping to get it soon. But if you have, you probably sat down and people ask you questions before they put the shot in your arm. Some of the questions might have been like, do you have a weakened immune system, or have you ever had an allergic reaction to a vaccine? Those types of things. And those are the questions that the EEOC is really talking about. There are two, if you could go back, there are two exceptions to the job-related and consistent with business necessity. It's one, if the vaccines are offered on a voluntary basis, so not required, and then if the employee receives the required vaccine from a third party not contracted with the employer. The other consideration here is that the questions may implicate GINA if they relate to any type of genetic information. Next slide. So the EEOC also touched on whether employers can require proof of receiving the vaccine. And yes, they do caution though that with requiring proof, you should not ask for any type of other medical information as part of the proof. I believe the cards, they just have, the vaccine cards, they just have your name and the type of vaccine you got, maybe the date. So those certainly do not have any other health information, but if you get like a doctor to give you a doctor's note that says you received the vaccination, just be careful, employers not to require that the employee give any other information with that doctor's note, no HIPAA protected information. Okay, so the next big thing that the EEOC discusses is employee accommodations. And this is really where the employers get tripped up with the analysis. And if you review any type of litigation, general litigation regarding vaccine mandates at all, not just COVID vaccine mandates, but just any mandates, this is the topic of most, if not all, of that litigation. So the two common accommodation requests associated with the COVID vaccine are the ADA accommodation requests, disability accommodation requests, and then those for sincerely held religious belief accommodations. And we'll touch on each of those briefly. But I think it's important to stop here and just note that, political views or anti-vaxxer philosophies, anything like that, those are not protected under those federal laws, the ADA, Title VII, anything like that, okay? So first we'll talk about the ADA accommodation analysis. It's a little different with respect to this pandemic and the COVID-19 vaccine. And I think the easiest way to think about it is that it kind of adds an extra step here. So under the ADA, an employer cannot exclude individuals from the workplace with disabilities for health and safety reasons like a national pandemic unless they pose a direct threat. And you'll see on the slide, direct threat mainly means that there's a significant risk of substantial harm to the health and safety of individuals in the workplace. And the EEOC recommends the 4-factor direct threat analysis. You'll see the 4 factors there. I'm not going to go through each one of them. But I think one of the biggest, practical things that employers really need to think about here is not just consider employee safety, but really, patient, client, customer safety as well. So if you have employees that are coming in and having that direct day-to-day contact with your customers, your clients, your patients, those types of things, your analysis is going to be different than if you have an employee coming in and just sitting in an office typing on a computer all day. Also, I think another consideration is how many vaccinated employees are already in the workplace. So if you have, essentially all of your employees have already received the vaccine, they've already, gotten the vaccine, and you just have this one employee who is asking for an accommodation, the analysis is going to be a little different there as well. If you decide there is a direct threat, you should engage in the interactive process with the employee about the reasonable accommodation. The flexible interactive process, be creative, try to come up with some creative ideas about how to accommodate that employee. A majority of the time, however, really it's only remote work. So if you have the ability to move the employee to the remote environment, do so. Obviously, that would depend on the industry. Us in the in office settings, we can move to remote environment pretty easily. But others that, are in construction or industries such as hospitals, nurses, nursing homes, those type of things, they might have a little bit more difficulty doing that. So if you cannot find a reasonable accommodation, if there's some sort of undue hardship that prevents a reasonable accommodation, then you can exclude the employee from the workplace. However, as Rob will discuss, that does not mean that you can terminate the employee outright. You can exclude them, but not terminate, and you should certainly look at different options, such as other leave opportunities. You can keep going. All right, so this other big accommodation, go back, sorry. The other big accommodation request is the sincerely held religious belief accommodation. This is for sincerely held religious beliefs, quote, beliefs, observances, and practices. Under Title VII, this is an extremely broad definition. Even the guidance suggests that employers should ordinarily assume that there's a belief. You can ask for further information about the belief if there's an objective basis for it. So essentially, their reasoning for having the belief is not relevant here at all. So if an employee comes to you with a sincerely held religious belief accommodation request, you engage, you try to work things out, you try to determine if there is an accommodation that would work for the employee. Under a Title VII, the undue hardship standard is a little different. It's a de minimis standard, which means that it must be more than a de minimis cost or burden for the employer for it to be an undue hardship and unable to provide that reasonable accommodation. But similar to the ADA, if an employee cannot get vaccinated because of a sincerely held religious belief, and there is no available accommodation, you can exclude from the workplace. But again, as Rob will discuss, that does not mean that the employer should terminate outright. Okay, so with that, I'm going to kick it back over to Rob, and he will talk about more of the practical implications. Thanks, everyone.
Okay. So back to, Kirsten was talking about on accommodations and what you can do. So, again, to sort of put a fine point on this, the EEOC has said that you can terminate employees if they don't get vaccinated. You can do that. But as Kirsten said, and as I want to make clear, I think you want to think long and hard and try many options before doing that. So, and again, this direct threat, which is shown on the left there of the slide, if there's no reasonable accommodation, you feel like, hey, there's a direct threat. So what might be an example of that? Could be, let's say in a hospital, or let's say in a nursing home, and a nurse who's going to be in direct contact with patients, let's say refuses to be vaccinated, and let's say there's no work from home that's available, that's the place where that's I think going to be the hardest issue to deal with, because there you certainly as a nursing home are going to both have obligations towards your employees, but also towards your patients. And if you have a concern that somebody is going to be in direct contact with patients, then it's maybe more likely that you're going to take a very harsh stance on that to say, look, we can't allow you unless you're vaccinated. So I think that's where, those situations are going to be more difficult. Again, as Kirsten said, office settings a little bit easier. And so it's also very important, if you notice one of the bullets there talks about check the other applicable EEO laws and make sure there's no disparate treatment. What we mean by that is, all the discrimination laws still apply. So if you have some situation where you are taking an aggressive stance, or you terminate, certain people in a protected category, but not others who are not in that category, you run the risk, whether it was intentional or not, you run the risk of having a discrimination claim under Title VII or under one of the Ohio laws. So you need to certainly look at, consistency in what you're doing. And then over on the right with the that bullet point, in terms of creativity, look at your policies and handbooks, see if there's leave available. If let's say you are running into one of these sort of impasse situation, employee says, I refuse to get a vaccine, you feel like, we really need this person in the office, is there a way to have some other kind of a leave for a little while? Maybe you keep educating, maybe this person comes around before you absolutely have to get to that point of, we're going to terminate you. So I would say, look as much as you can to avoid termination. Next slide. Great. Voluntary versus mandatory. Basically just talked about this, that the EEOC gives you the go ahead. In terms of voluntary, you can encourage as strongly as you can. You can strongly encourage, strongly recommend, versus mandatory. And you can sort of get right up to that, but not make it absolutely mandatory, but push it pretty hard. You see some of the statistics there. And just anecdotally, I think when everything first started coming out on vaccines, I heard a lot of companies saying they're not going to mandate it and they're going to sort of take a wait and see approach. I've heard some others lately starting to get a little closer to that point of maybe they're going to mandate it. And we'll see. This is just anecdotal. This isn't, some kind of scientific study I've done. But I do think that there's going to be more thought given to maybe we're going to mandate this in some circumstances. You can go to the next slide. And after that one, what you may want to do, and again, things are rolling out quickly now. So this was pre-vaccine mandate surveys. But again, this is, if you're going to do this, I would act quickly. The point of this is you may want to have some communication with your employees to sort of figure out, is everybody planning on getting vaccinated? What are the issues if they're not? And, you can get some valuable information. It can then help you look at, what do you need to do? Do we need to educate some of the employees a little bit more? Do we need to give some more information? Do we need to bring in a speaker? Do we need to get more leadership from the top? What's going on with your employees in particular? And of course, it depends. Do you have a small workforce, 10, 15 people, or you are a large company with hundreds and hundreds of people? So that's going to be very different. Next slide. As we look at the HR issues here and potentially liability, this is also something I get a lot of questions about. Are we going to be liable as a company for anything related to the vaccine? And there really hasn't been much yet in terms of litigation on this. It'll start happening, but here are some potential areas where it may occur and sort of what we think about it. First, let's say a workers' comp situation. Let's say somebody has a significant reaction to a vaccine, and maybe it was particularly if it was given on site, and then there's some issue and they're out for some period of time. There's the possibility there could be a workers' comp claim. If so, I would just go through the normal practice that you have with your third-party administrator, whoever deals with it, and sort of let that run its course. Greater risk would be if you were going to be sued for what's called a tort, like an intentional tort, where somebody can go outside of the workers' comp system and actually go after you and claim that you were grossly negligent and caused serious harm, and you want emotional distress and punitive damages and huge amounts of potential damages. That I think is unlikely, but it's not out of the question. The main thing is, whatever you're doing, I would just say try to find what the right guidance is. If you're bringing in somebody to give vaccines, and we'll look right at the end here, I've got some guidance from the CDC that just came out this week. Follow the guidance. And if you do, and if something does happen, unfortunately, you're probably not going to be able to be, effectively sued if you show, look, we did what we're supposed to do. If some unforeseeable event happened, it happened, but you're not going to be necessarily on the hook for, some huge damages. So try to, do things the right way. OSHA, it has been coming out with some more information, as both Kirsten and Dr. Campbell said, if you're going to mandate the vaccine or not mandate it, you should still maintain all of your COVID protocols. I've had some companies ask, all right, now the vaccine's coming, so we just be done with, with masking and with social distancing and all this and that? And I think the answer is no. I think it's too early. I don't think it's the right time to let your guard down on that. And so I'd rather, be safe than sorry. Sorry, just go back one more, just real quick. On the National Labor Relations Act, very quickly, if you're a unionized workforce, you may need to talk to the union if you're going to mandate vaccines. So you should look at that. And then the last bullet point there of, discussing the safety and efficacy, there's a fine line there. I think you can certainly encourage, you can suggest it, all of those things. I don't think as employers, though, we want to get to the point where we're, pretending to be, physicians or scientists. I mean, we just do the best we can do with that. Next slide. Okay, and finishing up on HR issues, again, with education, I mentioned that there are things you can do to alleviate concerns and to deal with whether it's bringing speakers on site or virtual, giving out information. And again, if you do a little bit of a survey in advance or you ask some questions and you find out here are the issues that are coming up in our workforce, then maybe you can address some of those things either from the top down or from HR. So that's, I think, helpful. Wellness and incentive plans. I've seen some companies talk about creating incentives for employees to get the vaccine, give a gift card or some extra bonus, extra pay. I don't necessarily recommend doing that, but if you get to a point where you feel like you're not getting people interested, I mean, it's something you could consider. I will have one caveat there that there's a whole wellness legal issue that deals with the Americans with Disabilities Act. I'm not going to spend the time going through it, but the key point there is that it's unclear right now where the law is on that. There were regulations, they've been frozen. So I'll just leave it at that. And so before you do something like this, you should consult, counsel or HR and make sure that you're not running afoul of any of these rules from the EEOC. But you could certainly consider doing that. And of course, you may want to, tell people there'll be excused absence for getting the vaccine. If there's a side effect, provide people with an excused absence. All right, last but not least, this week, CDC came out with guidance on workplace vaccination programs, and really sort of two key areas I'll just very quickly talk about. One is trying to instill confidence in your employees about the vaccine, and there's some guidance from CDC. They've mostly focused on having, leaders, sort of vaccine champions. So, people in management really, showing sort of, walking the walk, talking the talk, showing people, yes, this is what we're doing. This is why it's a good idea. Be transparent with communications, give updates. So that was sort of one piece of it. It was really urging companies to step up and say, yeah, it's a good idea to get vaccinated. Let's encourage it. And then second is, should it be on-site or off-site? And this I found very interesting. The CDC sort of suggested, did not require by any means, but suggested that if you're a large employer and most of your employees, let's say, work in the same site. So think of let's say a big manufacturing facility that's very large and has room for social distancing. If you made like a pop-up clinic, they sort of suggested you may want to do it on site. And again, by no means required. And if you do it on site, there is a little more risk from a liability standpoint, I would say. You got to make sure you're doing it right and you're sort of standing behind this. But they sort of pushed that and said, you may want to consider that. Well, if you're sort of a smaller employer, you have people sort of working all over the place, not in one office, they've said it's more likely you should push people to just go to Walgreens, go to CVS, and again, and then show that they've been vaccinated. So it's worth taking a look at that. It just came out, I think, on Tuesday or Wednesday of this week. So I think that's really it from us. Again, to me, the key questions as an employer, one is, do you make vaccines voluntary or mandatory? You may want to start with voluntary and strongly urging it. And then, if you get to a point where you're not getting people to do it enough, maybe you consider making it mandatory or else. Where do you have the vaccine? Is it on site or off site? And basically, what do you do if employees won't get the vaccine? How do you navigate that? And that's all I've got. And actually, this afternoon I'll be getting my first vaccine. So this was very
perfect timing.
Very timely. So yeah, then I'm going over to Cleveland State, where they've got the Wolstein Center set up with thousands of vaccines a day. So I will be getting #1 today. So thank you, everybody.
Thank you, Rob. Thank you, Kristen and Abby and Dr. Campbell. You've all given us a lot of considerations around the vaccine, but in a really practical way. So we're definitely going to be sharing these slides because I love some of the tips of issues to think about. And likewise, Dr. Campbell, we'll make sure we put in the notes for participants today, those resources that you recommend for sort of how do we get past in this educational campaign, questions our employees might have. So if brains were not full of lots of things to think about for the future, we're going to give you a couple more with our last 15 minutes for the day. I want to introduce Jason Therian and switch gears a little bit to think still about the future, and also about communication, but more from a customer perspective. I have met Jason and the ThunderTech agency for the last few years. They have always been on the forefront of thinking through communication and really how to connect with your customer. And if the pandemic has brought chaos, they've brought all the more needs to really think through that strategy for your company. And I'm looking forward to hearing some tips and tricks from him today. Jason, I'll hand it over to you.
Great. Thank you, Abby. Appreciate it. So you've now got another profession that gets to talk for a living, but I will keep this brief because I know we've got an end goal of 1 o'clock here. As Abby said, we'll send these slides and my emails at the end too. We'll get through that. Real quick though, right? The status check, as Dr. Campbell said, this is something we are living with right now, and it's not over. And I think every client that we talk to, every brand, right, they bring a lot of their personal hopes or expectations or beliefs into sometimes equation, and that can get very murky. But these things are true right now, right? The vaccinations and also I think weather, especially in the northern states, are definitely pushing us out of the home and becoming more active. We have had incredible numbers on every e-commerce client this past week. I mean, so big that they look fraudulent. And this is because of the latest stimulus, right? So it's still rolling out. It was staged as far as we've been able to research. So again, if you have anything that can target folks that are getting that, right, it is doing what it is intended to. We won't get into this. We all know we spent a lot more time with our noses in our phones, on social media, certainly streaming. The amount of streaming this past year is amazing. That alone didn't break the internet, but some of these things absolutely are here. We didn't invent this, but it's definitely floating around, and we do believe in it at ThunderTech, is that this could become a decade of the home, right? Is it the full 10 years? No, but right, marketers make it sound good. We're going to be doing a lot more at home. You see all of the home renovations, the crazy home markets, the amount of various outdoor equipment that has just spiked and caused all these supply chain problems, right? It's every brand can look at this and figure out again how they can take advantage of it. And again, whether it's behaviors or expectations, these things are going to stick. So let's get into it. So digital transformation, right? A little buzzy of a term, but so many of you on this call and those brands that you interact with out there really had to dive in this year, whether it was e-commerce, whether it was various forms of interactions and customer service. Most that moved online, right? It's not negotiable to go back. Your consumer is expecting you to stay here. And I think it's a great opportunity for a lot of cultures to keep pushing, right? Fear and necessity drove a lot of organizations to finally adopt more digital centric or cloud centric practices. How do you embed those practices to serve the customer where they actually want to be? So again, another new one, but it's not going anywhere, is this expansion of the endless aisle, as it's called, right? That you can find anything, anywhere, anytime you want it. Certainly the direct-to-consumer market, the DTC, has exploded. So anybody that's in the manufacturing space, right? All the different wholesale retail relationships still can be there, but it has been a lot easier over the past year to move into the DTC arena. And you're also seeing a ton of DTC that are digitally native, brands that can pop up, go direct, find an audience, and if it's there, expand. If it's not, they shut down. But it's a much more flexible way of getting product to market these days. Certainly Amazon, but don't forget about all the other marketplaces. These numbers are huge, and a lot of the other big folks are playing catch up, but with real serious efforts. Practices like BOPUS, I love saying this term. If you've never heard it before, you've probably done it. Buy online, pick up in store, right? BOPUS. So things like that. I've already seen some of my favorite restaurants stop doing the curbside delivery to your car. And to me, it's like, why, right? If they've got data that tells them I'm the only crazy one showing up that still wants them to bring it and put it in my trunk, good for them. But I don't think that's the case. I think they feel this is over with, and they're going to just force everyone to go back to the old habits. And we tell the brands beware. That is a choice that, again, could have ramifications to their businesses. Content studios, the approach to create content, every brand has understood that for some years. The pandemic absolutely made it a must. This is an arena that, again, just as far as efficiency, we talk about this wheel over here and how to think about the content that you're putting out, right? It's not just the website and social media, and we'll see what we do with it next time. It's the dozen or plus different ways that you can use content, because the customer just wants it where they want it. Could be search engine, could be social, could be in the newspaper, could be in all these different channels. But how do you stay more efficient, as frankly, there's more demands put on your brand for more and more content. One of my favorite ones over the pandemic has been audio. So podcasting, at first, we do a lot of podcasting, post-production for clients. We figured with commutes, many of them obviously being shelved, it would take a huge hit. Podcasting is actually up 17%, right? So people are still sticking those earbuds, AirPods, or whatever you've got to listen to content in their ears. And it might be on the daily walk now with that new puppy, that pandemic puppy they bought. Yeah, I'm sure there's a few of you. Or, not all of it's in the car. But it's a big, big piece of brands that, again, the pandemic has accelerated. And we take one thing away from these slides. Look at that last acronym, COPE, C-O-P-E, create once, publish everywhere. It is still something we strongly believe in, and that not enough brands are really embedding into their culture. Many brands found out how important it was to develop an owned audience. And what we mean by that is that you're not going out and buying that audience every time you want to talk to them, because the media habits shifted so drastically, especially in the beginning and kind of over the summer, was that many brands were flat-footed because they were so used to buying it and not building and maintaining their audience. We all have them. We'll go through those in a few more minutes. Third-party data, right? This still matters, and especially for the smaller businesses. This is where I see the most problems, is that it's not just making sure your Google listing and your Facebook page has the right information. It makes sure anything that you ask Alexa or Siri or Google Home, Bing, or anywhere else is correct. the amount of wrong phone numbers from, restaurants that I saw that I was trying to help, especially in the early days of the pandemic, because they just didn't tend to these things. These data sources are moved around. Many are farmed out, resold, and one wrong piece of data about your business could be resold and end up on 10 different sites. So it still matters. It certainly matters even more as your consumer has higher expectations about it. For the B2B companies in the audience, right? Trade shows, they probably will restart, but our bet is they're going to look a lot different. The convention centers, the big hotels, convention visitor bureaus that we work with, right? They're all figuring out how to manage hybrid trade shows right now. And again, it's figuring out what does that do for especially a business-to-business brand. And a lot of that has to do with lead generation or taking care of existing customer relationships. So many ways to do that. I'm sure you've figured out many of them, but we do think it's a mistake to think that, post-COVID, if that's even such a thing, that trade shows are just going to pop back to normal. Another B2B one here as we're wrapping up is the sales and marketing shift. We did see across the board sales and marketing departments get a lot closer. And this graph here on the right just shows the 2x expectations of clients to be serviced digitally. Why are we doing this, right? To figure out what kind of business we're in. How do you repackage, reprice, rename, look at your offering in maybe a new light, not just push harder into the market. Certainly for any physical facility or venue, right? How do you get more spend on premise? Encourage those repeat visits. We had a lot of food companies that widened their menu during this time because they didn't want just the Friday night pizza delivery. They wanted the Tuesday night burger as well ordered from them. So again, instead of just being a pizza, an Italian restaurant, they broadened to be more of a Italian-oriented cuisine, food company. So again, how do you think about your positioning there? Certainly, client retention is always in our mind and was definitely higher up during the early days of the pandemic, but I think it's one of those things that shouldn't be forgotten right now. A lot of our customers sometimes are sitting on gold mines, and we'd say, listen, if you're going to spend 5 to 20 times the cost on getting a new client over an existing client, right? Why don't we look at where your existing clients are? They're sitting in spreadsheets, in loyalty programs, and all these other nooks and crannies throughout your organization. And even the biggest, most well-run organizations still have these nuggets sitting out there where you can find folks that are already comfortable with you. You don't have to spend as much to reach them. Quick plug, education, right? Helping is the new selling. This is what Erie County Economic Development Corporation is doing right this moment. Every organization, every brand can think more about how to put education out there, how to serve the needs of that brand, that customer first, and then have it reflect on your brand. So to wrap up, there's dozens of articles we published at this address if it's of interest. And again, we continue to stay on top of it. It is such a fascinating time. Stay nimble. Don't forget these lessons. And with that, Abby, 1 minute over.
Jason, I'm not sure how you packed that many insights into 10 minutes. I am continually impressed.
I didn't breathe.
In all seriousness, thank you. I love this idea that both at a personal and professional level, like this level of shakeup in our routines is an opportunity for your company. That slide of repackage, reprice, re-everything. How can you trial? And I think we still sort of have that window and shield to be able to do that.
Absolutely.
So thank you for the food for thought from all of our panelists today. We are in fact out of time for this afternoon, unfortunately. We appreciate the insights. We're definitely going to follow up with attendees and those on our email list. The last plug I'd give is that we will be back in 2 weeks for a presentation on how the pandemic is changing sort of the workplace from an employee retention and attraction standpoint. And I know
as we're all looking towards a better 2021, that onboarding task is all the more important. So what should you be thinking about for your employees? Is next up on the docket. Stay in touch with your questions. Jason, Abby, Dr. Campbell, Kristen, Rob, thank you again. See you soon.
Thank you.